In this discussion, John Carroll, Chief Editor and Founder of Endpoints News, will discuss personal reflections of Tachi's impact and legacy with James Wilson, Professor of Medicine and Pediatrics, Department of Medicine, and Director of Gene Therapy Program, University of Pennsylvania, Tachi's longtime friend, colleague, collaborator, and business partner.
Hello, everybody. This is John Carroll. I'm the editor of Endpoints News. I'm here with Jim Wilson from the University of Pennsylvania. Jim runs the gene therapy program there and is one of the great pioneers of gene therapy research. We got together a couple of years ago with Tachi Yamada to talk about some of the activities, some of the things that they were involved in together, their lives together. They've been longtime friends, longtime colleagues. And have just done an amazing number of things involved in gene therapy research and drug development. And recently, Tachi died. And it became apparent right when we ran the first story on this that there was just this amazing response, this huge response from our audience, a large audience of people, many of whom had met Tachi Yamada over his lifetime and had been deeply influenced and really inspired to do a variety of different things. He was an extraordinary individual, and I thought it'd be great if we could take a few minutes here and talk with Jim about the life of Tachi Yamada, the impact that he had, and what made him such an extraordinary figure in the biotech field. So, Jim, maybe we could get started with the first time you guys met. When was that?
Yeah, I've known Tachi since I was a graduate student at the University of Michigan, where he joined the faculty in the Division of Gastroenterology. And throughout our careers, we continued to stay in touch and intersect in many different ways. But Tachi was many things, no doubt. He just never ceases to amaze all of us in terms of his talents. But at the core of who he was, I got to know when he was at Michigan, starting his independent academic career. He was a physician. He was an extraordinary physician, and he cared deeply about patients. And I think that is where he derived most of his passion and his motivation. But he also loved science. He was a gastroenterologist, and he studied gut peptides. He considered himself a protein chemist, and he was very successful in that regard. I then, following that, went to Boston for my residency and postdoctoral fellowship, but was recruited back to the University of Michigan, where he was division chief of gastroenterology and Bill Kelly was chair. Soon after I arrived back in Michigan, recruited by Bill Kelly told me he was going to Penn. And I said, well, I moved my family to Ann Arbor. We're going to make a go of it. And Tachi became my boss. He was chair of medicine, and he elevated me to chief of molecular medicine and genetics. And I got to know Tachi as my boss, as a junior faculty member, and what kind of incredible mentor he was to me. I then eventually was recruited to Penn, and then I learned that Tachi was going to leave the academy. He was at the top of his game. He wrote a textbook of gastroenterology. He was one of the most preeminent academic physicians, held one of the most important positions in internal medicine, and he went to SmithKline Beecham. And I was a little surprised by that. But he never rested on his laurels. And I asked him then, and I've asked him since, and it was, he wanted to maximize his impact on patients. And he felt that he could do that more by assuming leadership positions in the pharmaceutical industry. Soon after he took that job, he became president of R&D, and SmithKline Beecham merged with Glaxo Wellcome, became GSK. And then he became president of R&D at GSK, one of the most important positions in the industry. And he did just an extraordinary job there. It was really the beginning of his second career. And he had many others after that.
Well, what were some of the things that he did at GSK?
So he was one of the first to create the notion of companies within companies. He called them CEDs, or Centers for Excellence in Drug Discovery. It was innovative and disruptive. But the second thing, John, that he said is that the best business is the business that addresses the needs of the patient. And it's all about the patients. It's all about the patients, and it's all about the patients. So it was focused on patients, and he continued that to the day that he left the company.
And then he went on to the Gates Foundation.
I think what I understand that they saw in Tachi was a successful leader in the biopharmaceutical industry, and for the Gates Foundation to move from sort of a funding foundation and to an organization that really needed to make an impact, that they needed to see the development of their programs through the lens of what it takes to make a successful vaccine or a successful product. And that perspective, I think, was unique for foundations. And Tachi brought that sort of business perspective to the Gates Foundation, where he succeeded on many fronts.
And from there, he went to Takeda. Now,
Yeah.
as I understand it, the Takeda move back to a large pharma organization, but different, much different in many respects from GSK. So what inspired that move?
Yeah, I don't know if many people really know this, but he talked to me about it, and he had been talking to me about it. He told me he had promised his father, who was a very successful industrialist in Japan, that before he called it a day, that he would make a contribution to Japan in a substantial way. And it was based on a promise to his father, among other things, that he said, this is a time when Takeda needs leadership and to sort of spread their wings and become an international company. And that's kind of what Tachi does. That's how he makes his decisions. It's about impact and loyalty. Went to Takeda and really, again, had a major impact there.
So then after Takeda, it's been interesting because his career spanned quite a period of time. Then after Takeda, what did he do after that? I know you guys got together at some point and started companies together and did all sorts of things.
Yeah, well, Tachi and I connected when he was at GSK, where I had sought his advice about what to do about righting the ship of gene therapy when we sort of hit the wall. And it was at that time he shared with me his vision of gene therapy as being a solution for rare monogenic diseases for which there's significant unmet need. And he knew I was a clinical geneticist, and he shared that passion of the underdog, the underserved. That's who Tachi was, but also a potential solution for drug delivery in the broader context. So that when he left Takeda, he surely didn't slow down, I'll tell you that much. He became a partner in Frazier, an investment firm, a venture capital firm, as well as a significant amount of his time in starting up companies. And that was a time when our program at Penn, but more importantly, the field of gene therapy was ready to step out. It was ready really to spread our wings. And we formed a partnership several years ago where he was my partner. And then more recently, this idea of considering to expand the concept of gene therapy into more common diseases, he and I appreciated the fact that the typical kind of venture investment probably didn't have the patience for that. And we started this company called G2 Bio that he really liked. It's incredibly innovative, where we have the flexibility to explore and to move into new areas. He and I were so excited about that. And we launched it, but unfortunately, months after we launched it, he tragically passed away.
So as I understand it, back in the day, you had some difficulties in gene therapy, of course, and he played a crucial role in terms of continuing to support the work that you were doing. So tell me a little bit about that. As I understand, he provided a lot of support for you during a very difficult time. And I was wondering if you could tell me a little bit about that, about how
Sure.
that.
Well, we had stayed in touch. He was at GSK at the time running R&D. I was at Penn. There was a patient death at Penn. The field sort of collapsed around us. I became a lightning rod, a target of significant controversy and criticism. I kept my job, didn't really know what the next move would be, and I sought him out. And he and I would get together really fairly frequently in a restaurant in Chinatown, just he and I in the corner of the restaurant, and we just talk. And he suggested that what the field really needed was better technology. And I agreed to that. And he said to me, well, I'd like to support that. He said, I believe in the field and I believe in you. And it was based on that investment that we then went on to discover this new family of AAV vectors that become best in class. But I would not have survived in my career, nor would the field of gene therapy be where it is right now if he didn't have the courage to make that decision. Tachi wasn't about what was popular. Tachi was about what was the right thing to do. It's typical Tachi, humble, doesn't toot his own horn.
When we got together, the three of us, I was really struck by how quiet he is. He's not allowed. He was not a loud individual. Very compassionate. Never seems to have lost perhaps the bedside manner of a physician, of a really great physician. And he was able to take time and talk about things that were clearly important to him. So he seemed to have a way of being able to convey what was important and inspire people to do better, than just, keep their immediate goals in mind and try to think about what they could do that wasn't necessarily self-gratifying or profitable or anything like that. And you guys have done a nonprofit in his memory. So tell me a little bit about the man and the kind of impact that you've seen him have on people.
The humility and the modesty, but he was regal. There was a certain presence that was hard to put your finger on. And when you were with him, he was not looking at his cell phone. He was looking at you, focused on you. And you felt like he cared about you. And not only the people that worked for him, but the patients that we were working for. At his core, he was a doctor. And everything he did was directed ultimately to maximizing his impact on patients. And that came through in many ways as well.
One of the realities of drug development and gene therapy is that you are looking for a market, and you are looking for a group of patients that will need your product and buy it. But you guys recently started an initiative that had nothing to do with that, really, a nonprofit that was developing gene therapies for such ultra rare diseases that there really wasn't any kind of a commercial market for this at all. You couldn't do that. So tell me a little bit about that and,
Sure.
and what you still want to achieve with this as kind of one of Tachi's legacies.
And I think it's an important legacy, John. For most of my career, there were no treatments for patients with super rare, disabling, lethal genetic diseases. We just diagnosed them. But now with the advent of advanced therapies, gene therapy, editing, RNAi, ASOs, there is the potential to make a difference. And the ultimate irony and paradox is some of the easiest ones in which we think we can actually achieve success are the rarest ones and not fall within a business model that would support investment and commercialization of the biopharmaceutical industry. And Tachi understood that better than anyone. And it was based on these conversations and as more and more opportunities surfaced in making an impact on these diseases, the more there was a sense of urgency. And he said, Jim, let's create a nonprofit. We consider it a different model, different models. And let's find, and this is what was different and special about this. He said, we're going to have to be creative in developing a sustainable business model for this nonprofit, a sustainable, and John, I wouldn't know how to begin with that. but Tachi, having danced in and out of nonprofits, the academy, and the biopharmaceutical industry, wanted to take a chance at developing that model. He and I fully admitted that we may fail, but we're going to try not to fail. But he kept reminding me that this is probably the last and most important chapter of your life, Jim. It's the Institute for Life-Changing Medicine. He wanted to be a part of that. He can't be, but we're going to continue.
Yeah, that really is quite extraordinary. So when you think about his legacy, when you think about the continuing impact that people have, drug development, gene therapy is a long, long haul. The things that you inspire, the things that you get going, often don't really lead to anything substantial until years and years later. And some of the vaccines that he got started are just now entering the market. And it's really quite extraordinary. You can have an impact in this industry long after you're gone. It's unfortunate that people won't always know, how these things got started and the individuals who did get them started. But the legacy that he has is one that also includes a variety of life-saving vaccines, a variety of major of gene therapy and drug development and things along those lines. So when you think about the legacy of Tachi Yamada, what are the things that most come to your mind?
Yeah.
The impact that he has that will continue for years to come.
Yeah, there's absolutely no question what I think he cherished the most, and I admire, and it's how he impacted on the people that work for him, and how he inspired people and educated them and mentored them. John, that is a sustainable legacy. It's not only what he taught me, but he taught me how to be a physician scientist, how to be who I am, and then teach those that work for me. I think what you saw, which was palpable and deep, were the colleagues and employees that he touched, and what an impact that he had on them. I think ultimately that is our legacy.
Well, there's a lot to remember about Tachi Yamada. I hope we've done a little bit of justice to the life of a great individual, and someone that had an impact, as I said, on so many different people. It really was extraordinary seeing that. Appreciate you taking the time, Jim.
All right, and it's great seeing you again, John, and thanks for WuXi AppTech to be able to once again celebrate Tachi's life. Thank you for that.
Okay.